It is indeed privilege to introduce one of the most foremost pioneers of yoga therapy in India and abroad, a distinguished physician, researcher, and visionary leader, Dr. R. Nagaratna, lovingly known as Didi. Dr. Nagarathna is the Chief Medical Director of Arogyadhama, the holistic healthcare center at Prashanti Kutiram, Bangalore. An accomplished medical professional, she holds an MBBS degree from Bangalore Medical College, MD in Internal Medicine from Mysore Medical College, and prestigious FRCP from Edinburgh. What makes her journey truly remarkable is her seamless integration of modern medicine with the ancient science of yoga. Dr. Nagaratna has mastered both worlds, the precision of allopathy and the depth of traditional yogic wisdom. As a pioneering expert in yoga therapy and co-founder of Vyasa's therapeutic initiatives, she has developed research-based evidence-backed yoga protocol for managing non-communicable diseases such as asthma, diabetes, heart disease, cancer, stress-related disorders. Her work has demonstrated that yoga is not merely preventive but powerfully therapeutic when applied scientifically and systematically. At Arogyadhama, she leads a unique model of holistic care where ancient Indian knowledge systems meet modern diagnostic tools, offering patients integrated evidence-based healing without losing the spiritual essence of yoga. Beyond clinical excellence, Didi is also a respected academician, a senior faculty member at Vyasa and Vayu, and guide to numerous PhD scholars advancing research in yoga sciences. Her scholarly contributions include more than 100 publications in national and international journals and multiple books on yoga therapy. Her pioneering work has been recognized with several honors, and she has been honored in USA for her diabetic projects. Through her collaboration with leaders like Dr. H.R. Nagendra and the larger Vyasa mission, the vision of integrating yoga into mainstream healthcare has taken strong institutional form. Dr. R. Nagaratna represents the living bridge between medicine and meditation, between science and spirituality, and she is managing many patients and curing them also. So it is not only prevention but curing also. It is truly an honor to welcome her today to Dronacharya Voices of Yoga Guru, episode 2. Thank you, Didi, and most warm welcome to you. Namaste. Welcome to our Dronacharya podcast channel, which is Voices of Yoga Guru. And we have our beloved Dr. Nagaratna Didi, a lady behind Arogyadhama. We cannot call only spinal cord. She's a brain. She's related with her soul and emotions too to this Arogyadhama. She's a director. Namaste. About her, she's a medical professional, done her MBBS, MD, FRCP London. And you are surprised to know that she has devoted her life for yoga and wellness of the society at large. We are having such an acclaimed lady. She has published a lot of books on yoga and wellness, as well as published her paper in international journal. So scientific research at Vyasa and Arogyadhama, we have combination of engineering and medical. So from mechanical engineering, and she is helping for human engineering. I welcome you, Dr. Nagaratna Didi, and I'm sure our viewers will get a lot of insight into the yoga, what is happening at Arogyadhama. Didi, my first question to you is that you are such a
having expertise in your medical field, you did your MBBS and DFRCP in London. Why you have chosen yoga as a field for your career, for your life, for guidance of the well-beings?
Yeah, namaste to all of you. Namaste, Sunadaji.
Thank you.
Yes, it's a very simple question. I was working in Department of Rheumatology in UK. And lines and lines, big ward full of rheumatoid arthritis patients having 8 joints replaced, 12 joints replaced. And I was an expert in giving intra-articular injection to minute joints because I had small hands. I was very expert. But Sunandaji, at that moment, that was 1973, 74, even that time, medical science has already told that rheumatoid arthritis is an autoimmune disease. Autoimmunity, mind-body disease, or lifestyle disease, etc. was already researched and published in medical books. But what are we doing about the root cause? We are giving them medicines, steroids, or other injections to suppress the inflammation at the joint level. But although we know that the problem is in the lifestyle, in the mind, there was no technique available for handling the mind. And those days, there was nothing called integration of psychology, psychiatry, etc. in rheumatology. So once we started thinking about this, simple thing was to give them DRT, deep relaxation technique. There were lines in the dormitory ward. I would go and stand there, give Shavasana instruction, and they all started saying that, wow, after a long time they had a sleep, relaxing. And my background was also like that. For several years I was under the guidance of Nagaratra, Satyanarayana Shastri. In fact, to study Vedanta, to physical yoga, breathing yoga was a passion. So already there was a strong family support. So we decided. When I came back from UK, I went to Kanyakumari. Dr. Nagendra was already there. I returned from USA, and Eknath Ranade was the strong leader those days. He used to help us, guide us, take us through. So he decided, he talked, he called both Dr. Nagendra and myself, and then said, you're a researcher, share medical knowledge, both of you should together bring out the best of the knowledge from India to help people. Dr. Nagendra, of course, was already a big researcher. He was also into yoga, etc. Then what we did was, okay, it was Dr. Nagendra's great idea that we should touch yoga in the most needed condition, that is health problems. If you tell yoga is good for wellness, yoga is good for healthy living, they wouldn't understand. But somebody is suffering lot of pain, lot of blood pressure or diabetes. If we touch them and show them how mind is important, how mind works, then that is the best way. So take from the sickness area and start developing. Even those days, I did not know what to teach, although we knew the asanas, pranayamas, kriyas, Vedanta, right knowledge of what is the purpose of life. All these we were all very familiar. But what I am going to teach to the participant was not yet clear. So that time, our Eknath Ranade and Nagendraji together told us, you go around the country, visit all yoga therapy centers, whichever ashram they are doing yoga, some therapy work. You visit, spend enough time. So we went on for 2-3 months and visited all the centers, starting from the east Hyderabad, Kolkata, Guwahati, and western side, Rajasthan, and Mumbai, etc. And I would interview the participant, I would interview the guru, ask them what you are teaching, how you are teaching, how it works, make big notes. Came back to Kanyakumari and started with some data analysis. But it was absolutely unconnected. Some guru says, for some problem, you should do this asana. Other guru says, no, you should never do that. So it was big chaos. There were centers where they were doing only meditation.
Mm.
Some places where they were doing pranayama. Some places where they would do even shishasana for health problems. Big confusion. But we didn't discard the data because I have examined the participant. Then one day it flashed to Dr. Nagaratna. Hey, we got the point. They're all doing yoga. Whether it is physical yoga, breathing yoga, meditative yoga, or Vaicharik yoga. They are doing yoga. Yoga is mind management. Oh, now we got the point. I started developing the module.
So, Didi, you started from Kanyakumari. So, from medical professional from UK, you came and you made. So, I think Ranadiji has inspired your journey, and Dr. H.R. Nagendra, your brother, he was a supporting and guiding. So, it was a combination of you three, and then you went around all over India.
Ranade was a motivator. He was not involved in developing the techniques. He said, you should build up a big, preferable yoga therapy center. And he asked me a very interesting question. Where you will do, what you will do. There was a big hall like this, where some 8-10 people could do yoga. There were 3-4 rooms already there. I told him, Ajay, please give me this area. We'll start doing it. He got so angry and said, what nonsense, you are going to be restricting yourself to this small area. You should become a internationally known, scientifically acceptable, evidence-based, where you become something like those days, Vellore Institute of Technology was very popular. You should build up a yoga center like that. So that was the motivation he was driving everybody. And Dr. Nagendra, with all his experience, was totally into this. So both of us together. And we also had one very yoga professional who knew all the asanas, all kriyas, and adapting that. So then we sat down and started working on it.
Okay. So viewers started with a joint pain and yogic means joining. Okay. So you started with joint pain, but you came to yoga, wellness, where it is united, mind, body, soul. And then you traveled and you searched and you find out and did research. And as you two were very, very expert in your own field, you built this S. Vyasa University. As there was a vision given by Dr. Ranadiji, you make very big and globally acclaimed center. So Didi, you are leading this Arogyadhama. So you came with some vision to start Arogyadhama. So is that a vision evolved with the time and you
Yes,
obviously. Okay. So
decided to start everything straight away on a research basis. And we also very clear that it should be holistic approach. It's not somebody has got some wrist pain, we're going to do something there. Not somebody has back pain. It should be holistic. And as I told you, we have to manage the mind of the person.
Right.
So for that, physical yoga is equally important. Meditative yoga important. Understanding theory is also very important. So we continuously were emphasizing on integrative approach to yoga therapy, which we call as IAYT.
Didi, will you please elaborate what is IAYT to our viewers? Because integrated yoga therapy approach, they should understand what it is.
Yeah.
Because when you were doing research, sometimes you feel this is meditation is helping. Sometimes you felt pranayama is helping. Sometimes you felt that this yogasana is helping. And then you realize, and then you came with a systematic approach of IAYT. So what is that?
The whole thing is another helping the people to work on their mind. Okay, today we know that many of the non-communicable diseases are lifestyle diseases. In lifestyle, there are 4 things: diet, lack of physical activity, leading to obesity, malnutrition, malnutrition, nutrition,
malnutrition,
and leading to obesity, and habits, sleeping habits, eating habits. Today, what is the biggest problem? Screen addiction. Like that, several habits. And last but not the least, mind, overthinking, stress. So, we know very clearly that these are the combination. Maybe 25, 25, 25, 25, or 75 and only mind is involved. So, we have to approach the disease by giving deep rest to the mind-body complex. Mind, what is happening, how it should be handled. This is the expertise in Indian knowledge system, isn't it?
So calming the mind and cooling the mind is very important.
Using all these techniques. Say, what we understand is, the whole thing we said was mind-body disease. So in mind, what are we doing? What aspect of the mind is the problem creator? What aspect of the monkey is the problem center? That is our persistent, long-standing, chronic overthinking. Over my brain, which is only 1 kilo weight, has to control 50 kilo or 80 kilo of the body. And it is the controller. If the mind is all the time using brain cells, it starts getting exhausted, tired, it sends wrong chemical messenger through autonomic nervous system, endocrine system, which affects the immune system, and that immune system start doing viparya. What is viparya? Confusion that the immune system, which is highly trained defense system of the body, starts recognizing our own body tissue as foreign and fights. See, we have just gone through the pandemic. Immune system was so strong that it could recognize this as a very strong enemy and kill them. But once that is over, it is something foreign, okay. Enemy, okay, from outside. But if it is my own issue, the immune system is now confused. It is still thinking that our own bodily tissue is foreign and fight. So what did you understand? And the whole problem starts in the Manomaya Kosha as uncontrolled spinning speed of thoughts in all our negative emotions. Persistent, long-standing, suppressed negative emotions like anger, fear, jealousy, hatred, depression, frustration. This is our problem. Long-standing, short period, no problem. Therefore, the sage Vasishtha, it's on just one single cause for all these that they said it is when we are anxious or worried, mind picks up enormous speed, persistent, long-standing, uncontrolled spinning speed of thoughts. USSD we call that. That starts disturbing the entire physiology and results in uncontrolled fighting at the physical level. If it is a fighting at the pancreatic level or obese cells level, then leads to diabetes. If it's in the joint, arthritis. If it is in the heart disease. So, starting from the mind field, prana field, body, anamaya kosha, we call it field, the whole thing is uncontrolled, overcome the brain, immune system, etc. So we have to tackle all the areas.
You mean to tell to our all viewers that we have to work on mind first.
Exactly.
Mind is very important. And that is when you are not taking care, it is affecting our whole system. So all five koshas mein, annamay kosh pe, we youngsters are doing asana. They are not understanding how to integrate everything. And as you have mentioned, Vasishta, he has given very small line that mana prashamanam paya. So your message is to work on mind, mind and mind.
Slow down and
Slow down. Shamana. So we have to shant. And the name of your premises is also Prashanti. So the way we entered in the Prashanti, nature is blessing us. And then the therapy is taking toward Shamana of mind. That is why it is known as a Prashanti. So Didi, under your able leadership and developing and doing research on different elements, as it is affecting different things. So you have developed this integrated approach of yoga therapy and
specified practices.
Specified practices. So does this make difference in other yoga wellness centers and yoga element centers all over the globe and Prashanti Arogyadhama?
First of all, the difference is the evidence. We implement a project, implement a protocol, and record the data before and after. And that is the biggest evidence that has developed over these 40 years. We have had more than 1,000 publications.
Wow.
In peer-reviewed, high-impact journals. So our very first publication was in British Medical Journal, which was a very high-impact journal. That was announced in 1985. So whatever we started doing was to implement physical part of the yoga also, breathing also. If somebody is doing 1 hour practice, 20 minutes physical yoga, 20 minutes breathing yoga, and 20 minutes meditative yoga, and intellectually, people should understand what I am doing, or how it is going to affect, etc. And this is bringing miraculous results. That was the first paper in PMJ where we were able to demonstrate medication requirement drastically coming down.
Mm-hmm. So Didi, you said ki when it is published in the first British paper, it was a miracle. Will you tell me one? Now there are many cases in your now these 40 years you are here. So one patient who came to Prashanti and he went out of Prashanti after a treatment. Any one story which is near to your heart?
This is every day, every week we see miracles. It has become a statement that people come in the ambulance for climbing a hill. That's what we see. I'll tell you one example. May not be directly related to asthma. Every day we have 8 different departments. Neurology, rheumatology, cardiology, where we develop special technique specifically for the disease, which is another major difference between other institutions and our institution. Because although we said it's all mind calming down, how to calm down the damage that is happening at the physical level needs physical yoga, specifically for this. For example, if somebody comes with hypertension, we cannot teach him Surya Namaskar. We cannot teach him Pavanamuktasana Kriya or something like that. So we have to tailor-make the practices. So I am reminded of one lady. Our back-end department is the most popular, and diabetes, of course. This lady came with severe bedridden and a case of excruciating pain in the back, going down the sciatic nerve, and she couldn't move out of bed. She was brought in a stretcher, and we admitted, and we started working on the entire thing. Physical yoga was minimal because she was in bed, lot of breathing, lot of meditation, and counseling, making her understand what is happening in your back. What it's only overactivity of the inflammatory tissue. We have to send our mind to this specific point on the back. Do painless practices, which helps them. For example, in this study, anything you try to move the leg with the knee stretch would give her the pain. So we said, don't stretch the leg. Gently take it on your tummy, which you call as Dronacharya or straight. Or just lying in bed, press your back to the bed, release, press, release, press, release. But bring your mind to that point. That is the major thing. Once you bring the mind to that point, focus, understand, pain is nothing but increased activity there of the pranic energy. So increase, slow down, slow down, slow down. Gentle movements, lower movements, painless movements, and then slowly relax that point, diffuse on that point. This is what Patanjali says as Prayatna Shaikilya Anandasamabhatanti in the local area. And she stayed for 3 weeks, and she was able to walk around, move around in the campus. My pain was continuing. We added some simple verification, etc. Then, most difficult thing that many people find is when they go back home, they cannot continue. They cannot. But this lady was so sincere. She continued. 3 months later, she comes. Now I am moving around, talking around, minimal pain. I am being careful. To cut the long story short, she comes after 2 years and says, I am totally free from my pain. And now I am planning to conceive my pregnancy. Wow. It was long awaited.
So, Didi, you meant to say there was no operation, nothing. Only you have worked upon her situation, mind-body combination.
So simply the epitomism. It is all giving conscious, wakeful rest to the sick organ by using suitable practices.
So you mean to say yoga is much beyond mat. It takes you to mind.
Yeah.
So mat to mind is a journey. That is what you want to tell everybody. Because right now what youngsters feel, yoga is to reduce weight. Yes, obesity we have to control. But it is not just a reduction of weight, or it is not just a flexibility. What is more important is therapy, which you are giving from patient to patient, and then developing this, your research with every patient, you mean to say. So it's getting evolved. Your research is also getting evolved.
Every participant is our open book. We learn from the experience of the participant.
So main guideline is that so many things we can avoid by operating or working or going to allopathy. Allopathy is good. It is required at some time. But if we work what we call Adi with yoga therapy, mind therapy.
Medical science has already proven this. These are all MCDs. Cause is not outside, but it is within my internal imbalance.
So do we work on all our inner potentials and inner energies and vital energies to heal our body and mind? It helps like that. So Didi, you have mentioned right now about the diabetes. And like India is becoming capital of diabetes, and you are mother and a guiding spirit for this diabetes, and a project which you have undertook, a biggest project where you have got award and the USA also. So can you highlight, because now in India we see that the school going children, youngsters, everybody is suffering from diabetes and heart attacks. So what is exactly you are working for diabetes?
Let us say, what is the cause? Say, as I told you, several years back, the medical science has proven that even type 2 diabetes is a lifestyle disease. Like type 2 because it is in the adults. So adults diabetes is again lifestyle. Lifestyle, I told you 4 things. Diet, lack of physical activity, irregular sleeping and other bad habits, and overwork on the brain. So that is what is going on. Medical science has understood. It's encouraging people to adapt and go to gym, do aerobics or sports activity as a part of your daily routine, and see that you don't become obese, you sleep better, etc., etc. But in spite of all this, diabetes incidence is increasing. This is where we should make our participants understand. With all these physical yoga that you are doing, what is happening to your mind? What are they see these diabetes participants, they see they have very strong personality, strong willpower. They can work long hours, workaholic also, and achieve something great in their life. And therefore, they push themselves to do more and more, more and more, more and more brain work, losing sleeping time, etc. No time for physical activity. They say that, okay, I go to my gym every day, then I do my walking, but why am I diabetes not getting under control? I'll give you an example. One gentleman was here from Rajasthan, very senior person in the state, very highly respected. He had an international hotel business. So every 6 months he should go to Jocelyn for his medical checkup. This was going on for 5-6 years, diabetes and medications were tried. And then the doctor said, now your pancreas is not working enough. I have to put you on insulin. He said, okay, I'll wait for that. And he came here. When he came here, he understood he was already taking very healthy diet and doing physical activity and also good sleeping habits and other habits. Those days, his screen addiction was not bad. After pandemic, this has become a very problem. And stress. He says, yeah, I'm a very good performer. I got international business. Yes, sometimes when there are problems, I may overwork my brain. And I would take the name of Sri Ram whenever there was unsolvable problem, a good bhakta also. But it was not helping. What I understood after coming here was that to handle the mind is the foremost thing. So he says, an example, I'm driving in Delhi, I get a phone call from my new business where they said it's a very big problem. And earlier what I would have done, I would have sat down, make some points and give a solution. And that would work. Because I'm very capable of doing that, good experience also. Okay. But in spite of it, sugar was not coming under control. So now what I understood was, first I had to switch off the mind. What I tell my client on the other side is, wait a minute, I'll come back after 15 minutes. And I would first say that, my dear monkey mind, wait for a few minutes. I'll take 3 minutes to switch off my mind of all thoughts. 1 minute Kapalbhati, 1 minute Nadishuddhi, 1 minute Omkara, switch off my mind, and then Sri Ram, surrender, and now find the answer. Can you believe that this has helped him to completely overcome his anti-diabetic medication?
Wow, such a great message of a successful businessman, and a solution was given. And he was telling, mind your own business. So from mind your own business to working on mind, taking breath and giving some time for mind. Thinking, monkey mind, stop. So calming down, cooling down mind after a break is very essential that you want to focus. So our focus should be that we should take break, whatever we are doing, karma, whatever is your work, you take a break. Like we drink a water after 1 hour, you also take time to calm down your mind, cool down to your mind, divert your mind. And one more important thing is chanting. So remember surrender and gratitude. What a great message you have given to all our viewers. So only yoga asanas are not working, Didi. Only pranayama is not working. You are telling.
When I ask some people, I am doing my yoga regularly. Wow, what is your mind doing at that time? If I ask, I'll be watching a TV news and finish my Surya Namaskar. That is
What's the use? So whenever you are doing anything, what Dr. Nagarathna Didi with her 40 years of experience telling us that whatever you are doing, if you are doing yoga asanas, whether you are doing pranayama, whether you are working, whether you are thinking, you have to focus on that and give a break, small break wherever you are, so you will not face this stress problem. The diabetes is known as a lifestyle disorder. So I also did my PhD in obesity. You are aware, you have helped me a lot with your knowledge and experience and medical knowledge. So always children. Children. So students come or the participants come and ask us how long we have to do. Now, suppose if we have given them this integrated approach of yoga therapy, a module, which we have developed for, say, diabetes, for obesity, for anything. So how long we should do? I told them this is a lifestyle disorder. So you have to do lifelong. But what is your suggestion to all of them? Because as you said, they said, 1 hour I am doing my yoga and I am not getting result. So what is your advice on this?
Yeah, I agree with you 100%, Sunandari. It should enter into our life. What is that in the lifestyle that you have to do? Start working on all these four. Diet, timely, homemade, freshly cooked, vegetarian diet. That itself is a big thing. And if they are obese and diabetic, cut down some extra carbohydrates. But that biorhythm of maintaining timely and duty, eat at the right time, homemade, freshly cooked, vegetarian, time, sleeping time fixed, job time fixed. Even if you want to work 12, 14 hours a day, if you can maintain that biorhythm of sleep, physical activity, etc., it's going to make a big difference.
So yoga is connecting us to nature. And you are telling lifestyles to be get connected with biological clock. So whatever is given Dronacharya in Ayurveda, we should follow. So you mean to say late night awaken and eating pizza and fast food is not advisable. So main is a diet. Ahar. That is what you want to tell. Ahar is very important. Then mind is very important. Yogasana and pranayama, yes, it is
that helps in calming,
calming down, balancing everything. So balancing, samatvam yoga uchyate. You mean to say you have to balance everything. Didi, this HbA1c level, where have you tell our viewers or will you tell them that HbA1c above 10, above 11 also came down?
Yeah.
So
in fact, we have published several papers on diabetes. There was a research that we carried. I'll tell you an interesting thing. There was a lady from Germany. She wanted to do her master's dissertation on diabetes. She is now working in the lecture in Switzerland. She came here and we conducted a medical camp in which she was very keen. We recorded everything. We recorded the blood insulin level, HbA1c, lipid profile, body weight, stress level, everything she documented. And camp was over 3 months. And then we repeated the test again. They were all very, very happy. They were enjoying the class for 2 hours every day. And we noticed that the fasting blood glucose has reduced, but and weight reduced, etc., as expected. But their insulin, blood insulin level came down. So patients started worrying. I thought I'm doing yoga to increase my insulin in the body and it has reduced. Why? They were all worried. This is where we should understand. The pancreas is not dead, but pancreas was producing lot more insulin to cope up with the result of trying to push the glucose from the cell. It is insulin resistance that was sending a message to the pancreas. Oh, I'm not able to receive my glucose. Please send more insulin. Then pancreas was overworking in initial day. And once the insulin resistance, where the blood glucose has to enter from outside the cell into the cell through this mechanism of insulin combining with the receptor, was the problem. So it is not the lack of insulin in type 2 diabetes, it is insulin resistance due to obesity. So once they reduce their weight, once they feel better, no stress, etc., the message to the pancreas was, okay, I can manage with whatever less insulin that is there.
So it's a myth, Didi. Pancreas is dead is a myth.
Exactly.
It's a myth. And with experience and so one thing is very important, viewers, that here at HSA, students are coming to learn yoga. They are coming to take it as a career option also. But one more important point which Dr. Nagaratna Didi can only insist that every doctor, if he learns yoga therapy,
Guest problems.
it will help everybody, right? So we do have a courses for doctors, yoga therapy courses, which are of short duration. So if doctor implement this in their regular prescriptions, do this yoga, do you think that we will help wellness of the community at large?
That is the key point. That see, they have gone to the doctor with full faith. Whatever he says, they have to do. So this lifestyle program, what is happening in diabetology department is doctor has very less time. So they have created a new cell where there are facilitators. So they have to sit and talk in detail about diet one group, about physical activity another group, yoga one group, so that they will have more time to talk to the facilitators apart from the doctors' time itself. Otherwise, doctors, there is a big waiting list, and so you'll only have 5 to 10 minutes to adjust the medication time. But the other supporting group in the clinics are the ones which are very, very important. They call them as diabetes educator. So one group on nutrition, weight management, and psychological counseling, yoga, so integration is happening. And in our center, not only we do this counseling on the lifestyle, we add on detoxification through naturopathy, Ayurveda, etc. Use very same evidence-based, non-interacting with present medical thing. We will be able to help them much better.
See, Didi, in management we say, learn from horse's mouth or know from known. Now you have an experience of medical field, you are having a discriminatory education, that is MBBS, MD, FRCP, and 40 years of yoga, and you are telling that all doctors should study their patient history, lifestyle, then do research.
No, they already know Sunandaji, but they have very little time. That is where supporting system is very necessary.
Supporting system. Like we have at Arogyadhama, that it's a combination of many doctors who are working and helping. our patients who are getting admitted, and that's why you are getting some miracle happening over here. Now here we see when we go around the university, many people, like you also have said, कि from Jammu se aaye, idhar se aaye, this students are also coming from west more than east India. Why it is so? Why our
This knowledge is an Indian knowledge.
Indian knowledge?
Yeah.
Okay.
Where, although the whole world, as you rightly said, doing yoga as a fitness training, therapy is only possible by going into very deep understanding of the conceptual basis, help people to come out of their emotions. So it is a much deeper correction that has to happen in therapy.
You see, nowadays we see that students, they are taking just a course of 200 hours, 300 hours, and they start their studio and yoga therapy. And here what discussion we had and what knowledge you gave, that it requires a continuous study, upgradation, doing a research, and then coming out as a yoga therapist. So what you will guide these people who are just,
No, what happens, Nadaji, when people come for competitive yoga or, as you rightly said, fitness yoga, to keep their body shape, that forms the bottom of the pyramid. They enter through it. Then they go higher, go higher, go higher. And it is the great advantage of the yoga teachers to implement this slowly, gradually. Says people come to you only for fitness, I want to do more dynamic, physical yoga, etc. And in that, the teacher introduces 5-10 minutes every day, every class, that look, when you are doing this, focus on the part of the body. Give more strength to the part. Mind that part, give rest to that part, and give them the concept of ayurveda. Slowly, slowly. Therapy is only at the top, but we have to see that wellness is made by these wellness. That is the groundwork.
So you mean to say we have to start from Annamaya Kosh, Pranamaya Kosh, Manomaya Kosh,
No,
Vijnana
all
Kosh,
koshas together only.
together.
That's what you are going to impress upon as a yoga teacher, even at the first level. As a yoga instructor, what we tell them is if you are taking 1 hour class, give 5 minutes for theory of it. What is yoga? What is the purpose of life? What is the meaning of life? What is happiness? What is devotion? What is bhakti? What is seva, attitude in karma yoga? By 5 minutes, spread it over 30 minutes, 30 days or lifelong, and incorporate all aspects in that 1 hour. Physical yoga, breathing yoga, meditative yoga. They will realize very soon that the burnout that was happening in their running or jogging or sports or their gym is not happening. To put it in very simple terms, if you are a bodybuilder in a gym, immediately after you have finished the gym, stay in the same location, do your relaxation, do your mind on resonance technique or shavasana, and breathe in for 15-20 minutes and get out. So it is 50-50. Working on the mind is 50 with slow pranayama, slow meditation, chanting, and 50% high intensity training.
So that's why this yoga instructor course, which is an eligibility criteria for any other course, combines everything that is theory, practical, and 4 streams of yoga. So students are getting not only knowledge of yoga asana or advanced asana, but they are getting knowledge of a base of yoga therapy, which is given in say Bhagavad Gita, Ved Upanishad, Yoga Vasishtha. So that is a right way to enter, if you are interested, youngsters, to understand this, to yoga instructor course, which is run, and then they can choose yoga therapy or higher education or anything. But do not start just practicing you or teaching you after 200 hours of learning.
They can teach.
They can teach.
But 200 hours should include this now.
And theory should be there.
Theory is very, very important.
Because theory
And
is very
most important, as you rightly said, they should be experiencing that yogic state of infinite silence, infinite bliss, infinite knowledge, infinite creativity, and infinite freedom inside. And for that, a teacher was completed YICR, DSCR, MSc in yoga, should be able to spend their own time to touch that source of inner blissful freedom.
So you mean to say yoga is a journey of self to self. And that has to be understood by yoga sadhak before
It
he
is
starts.
as simple as this, no, Sunandraji. If you have to teach physics in the college, you would have done master's degree. Without master degree,
You
you
can.
cannot teach.
Okay.
So a teacher's training program we are conducting so beautifully in Pune.
Yes.
That is very, very important.
Yes, yes. And we are expanding also. We are expanding and it is based on ex Vyasa and Vyasa and whatever is there. So I mean to, what we understood in this, our discussion on this podcast of Voices of Yoga Guru, that yoga is a journey. Again, for lifestyle disorders, we have to see that I remember and recollect Patanjali Yoga Sutra from Samadhi Part, number 14. That is Didi Satu Nirantar. Satu Nirantar Dirghakal. Sadgara Sevesu Dudam. So yoga is everyday practice. You have to do it regularly. It has to be a part of your Dronacharya and work more and more on your mind and silencing your mind, spending time with your mind. In a day, take a break and tell your mind to monkey mind, keep quiet. Is this small? Within one line, what message you will give it to everybody? And then we'll come to rapid fire round.
Be happy under all circumstances. Easily said, don't. What is happiness? Mind is free, mind is quiet, mind is working in the right direction. If they can maintain the basic level of bliss under all circumstances, nobody's life is a bed of roses. There are always ups and downs. Krishna Bhagavad Gita says, Shita Ushna Sukha Dukkheshu Samaha. When you are happy also, if you maintain the deep voice, and when distress comes, maintain the deep voice at the psychological level. That is the way to prevent, treat, and heal rehabilitate the problem.
Now, Didi, I'm taking rapid round. Okay. What is your favorite yogasana?
My favorite is Nidra Yoga.
Nidra Yoga. Nice. One book everyone should read, which is published by you, authored by
The
you.
basis of promotional positive.
Basis of Promotional Positive Health. Tea or herbal decoction?
Say that again.
Tea or herbal decoction? What do you like?
Herbal.
Herbal decoction. Didi, we have lots of festivals in India. Right now also Ganesha is going on. So we do Aarti, Puja and then Prasad. So 12 months, we go on eating. So what you have to say as an expert of diabetes?
In Canada we call it as sweet eating. That is the mother. Vegetables. 80% of your plate should be
Vegetables.
green vegetables.
Okay.
And again I insist, timely, homemade, freshly cooked, regular vegetarian.
So you are boycotting sweet.
That biorhythm is very important.
Yes, yes. One health tip you follow daily. You have given many tips to our viewers. But which tip you follow?
Biorhythm.
Biorhythm.
Timely, time for it.
And Didi, my observation, I know you since 2012 now. I've seen you every time barefoot. So,
You have seen me what?
barefoot without choppers. So,
Not always.
it's not always, but many times.
In the campus I walk because nobody speaks in the campus.
So, boycotting spitting is a message to our viewers. One word that defines Prashanti for you. One word.
One word is Shanti.
Shanti, in Prashanti. Very good. A role model who inspired you in your life?
Our teachers, starting from Satnarayan Shastri, and my aunt who made us this, get into this understanding. My grandmother, there were series from my grandmother's time. My auntie was the major person who takes responsibility of educating us and giving this knowledge. And Dr. Nagendra, who is the Guru for everybody and
Everybody, for you also. So you mean to say our Guru, our parents,
and his
our ancestor,
Narayan.
Narayan Shastri.
I used to fight with him like debates, understanding.
Understanding and debating. Didi, thank you so much for sharing your wisdom, your journey, your holistic approach towards life, yoga, and telling again and again that sattvic ahar is very important. So eat fresh, green, salad and fruits, 80%, and remaining 20%, whatever you want. So, really, she has given us a message that yoga is a lifestyle, so we have to follow. Just do not limit you for that 40 minutes, 50 minutes or 60 minutes. Work upon it. Work upon your mind, because yoga is a journey of mind. Calming down your mind is very, very important. And we have understood this from an expert who is MBBS, MD, FRCP, and last 40, 50 years into the yoga, published many books and many research paper and done research. And every day they are doing research on different patients and miracles are happening. So why to wait? Visit once the Shanti, join as Vyasa, and be happy, be calm, and be lighter. Thank you, Didi.
Thank you.
Let's have a Shanti Mantra prayer at the end.